McLeod Health presents Count on Health.
COVID-19 is a type of novel coronavirus. It presents differently in children than it does in adults. Most children are either asymptomatic or have pretty mild symptoms when they have COVID-19. A lot of times they may present with fever, runny nose, cough, maybe even a shortness of breath or chest tightness in older children that can verbalize that. But for the most part, there are many children that are asymptomatic and have the virus and maybe have just a runny nose and don't even know that they have had it. Whereas in adults, especially adults with pre-existing conditions and older adults, they oftentimes have much more severe symptoms with the virus. We do know that COVID-19 affects children and adults who have pre-existing conditions oftentimes more severely than those who don't and who are previously healthy. So for parents who have children who have asthma, diabetes, immune system disorders, or anything that puts their immune system at risk, they are at a higher risk of having severe symptoms associated with COVID-19. So I do think those families do need to take extra precautions and make sure that their children are protected against the virus. There is a new manifestation of the virus that we have seen as we've dealt with this over the last several months that they're calling multi-system inflammatory syndrome in children, or MIS-C for short. So this is not something that I would worry about if your child has a rash but is otherwise acting normal.